Surgery, anesthesia, and pain can cause you to take shallow breaths, putting you at risk for developing pneumonia and other respiratory complications. That's why exercising your lungs after procedure is so important to your recovery. A positive expiratory pressure device, frequently called a PEP device, is a breathing tool that helps keep your lungs open and clear after surgery. This video will teach you how to use the PEP device, so please watch all the way through before your surgery. While in the hospital, you'll be asked to take 20 breaths through your PEP every hour while you're awake. After you're discharged, you'll continue to use your PEP for a specified period. The PEP has a mouthpiece, a side chamber, and a blue piston with a resistor setting. The resistor setting is 1 to 6, 1 being the hardest, 6 being the easiest. Your respiratory therapist will adjust your resistor setting. To use the PEP, sit up as far as you can in the bed or chair. Hold the PEP upright at eye level. Place the mouthpiece in your mouth and seal your lips around it tightly. Breathe in slowly through your mouth or nose and blow your air out through your mouth to raise the blue piston in the side chamber. Keep the piston between the two arrows. Now rest and breathe naturally for a few breaths. Next, take a deep breath in and blow your air out through the PEP device. Keep the piston between the two arrows in the side chamber every time you exhale. If you feel lightheaded, slow down. After each round of 20 breaths using the PEP, give 3 deep coughs. If you have an incision, protect it by holding a pillow firmly against your incision site while coughing. Even if you don't cough anything up, this will help clear secretions from your airway. For the next 2 to 3 weeks after surgery, use your PEP device 20 times every hour while you're awake. This will continue to prevent respiratory complications when you are at home. Please contact your healthcare provider with questions or if issues arise. Thank you for choosing Houston Methodist as your healthcare provider.